Welcome back to the Deep Dive, where we deliver the knowledge you need directly from the sources you share with us. Today, we're tackling a real paradox in modern medicine, especially as we get older. When does routine medical screening cross that line from being helpful to actually being a source of harm?
That is the mission today. We dove into some really extensive data, and it reveals a kind of hidden truth in geriatrics, this assumption that, more testing equals better health. It just often doesn't hold up for people over 70. We're trying to shift the focus from this fear-driven blanket screening to testing that's actually indicated, all based on the real risks and benefits.
Okay, so let's unpack that with some numbers right from the sources. We're looking at what researchers call over-testing. And some studies are indicating that up to 37% of medical tests that seniors are getting, they result in what doctors call a cascade, a chain reaction really, leading to treatments they don't need, serious complications, or even lifelong side effects.
And that number is massive. I mean, the source material suggests that nearly 99% of people over 70 are probably being over-tested right now. They're running tests that are just far more likely to spit out a false positive. A finding that looks really scary but is actually harmless than to genuinely save their life. So we've analyzed the data on 5 specific checkups that have the absolute highest risk-to-benefit ratio in older adults.
And before we start the countdown, we have to mention the most critical finding right up front. Just perfectly summarizes the unexpected cost of all this. We found a study that cites the #1 test on our list, a full-body scan, often marketed as, the best preventative care, as potentially being responsible for up to 5% of all cancer cases in the U.S.
5% of all cancers. That's statistically the same as the number of cases caused by drinking alcohol every single day.
Wow.
That's the unforeseen cost of relying on this technology. And we're going to count down to that test at #1, starting right now with test number 5.
Okay, so test number 5 is the bone density scan. You've probably heard of it as the D-DXA scan. It's quick, painless, it's supposed to check for osteoporosis. It seems like it would be totally harmless.
Right. The problem isn't the scan itself. It's the interpretation and then the treatment cascade that follows. For someone over 70, some bone loss is a totally predictable, natural part of aging. But when the scan picks up on this natural loss, it often spits out a result called osteopenia, which just means low bone density, even if the person is strong, active, and has never had a fall.
So the system is basically turning a normal part of getting older into a medical problem. It creates fear. And what does that fear lead to?
It leads straight to unnecessary intervention. Seniors are immediately pushed toward these powerful medications like bisphosphonates. Alendronate is the big one. And these drugs, which are meant to strengthen bones, they come with they have some pretty serious risks for older patients. We're talking severe gastric irritation and, in some rare cases, osteonecrosis of the jaw.
The jawbone dying.
Yeah, the jawbone literally starts to die. It can be just debilitating.
So what's the trade-off? I mean, how much benefit are people actually getting for that level of risk?
That's what's so fascinating. There's almost no demonstrated benefit for treating these mild age-related cases. Our sources point to a key study. It followed over 1,200 women over 70, and the researchers found that treating this mild bone loss with these drugs reduced the risk of a fracture by only 0.3% over 5 years.
Wait, 0.3%?
That's it.
That's a statistically negligible return. And yet, the sources confirm those same women were way more likely to suffer the side effects from the medication.
Exactly. And we see the real-world cost in the story of Rose. She was a 76-year-old piano teacher. Active, healthy diet, no falls, no pain. Her DEXA scan showed osteopenia, and boom, she was put on alendronate. 3 months later, debilitating reflux and jaw pain so bad she couldn't even sit at the piano to play anymore.
That is just the ultimate irony. A test meant to preserve her quality of life ends up taking away the very thing that defined it.
Precisely. And she only got better when she stopped the medication and focused on proven lifestyle changes. High-dose vitamin D, more calcium from her diet sardines, leafy greens, and, this is the key, weight-bearing exercises with resistance bands to build muscle and bone naturally.
So what this means for you listening is that the safer, more effective path, if you're over 70 and not, actively fracturing bones, the science is clear. Things like strength training, balance exercises, they've been shown to cut fracture rates by over 20%. We're comparing a 20% risk reduction with no side effects against a 0.3% reduction with a ton of risk. Okay, the lesson there is clear. Let's move to a test that weaponizes another part of natural aging mild memory loss. This brings us to test number 4, the brain MRI for memory complaints.
Right, so a senior misplaces their keys, forgets name, and the natural human response is fear of Alzheimer's. So the next step is often this high-tech, very expensive MRI.
And this is where that fear-to-test pipeline really kicks in. MRIs show the brain's structure, but they almost never give you useful, actionable answers for just mild cognitive complaints. What the scan will show in someone over 70 are normal age-related changes. A little bit of shrinkage, some white matter spots, which are common and totally harmless.
The harm isn't the test itself, it's the interpretation. Once those findings, even though they're normal, are on a report, they become abnormalities. And that just triggers this devastating cascade of panic, more tests, and sometimes even dangerous invasive procedures.
So we're testing for something that might be treatable, but instead we're finding a harmless condition that makes everyone feel like they have to do something.
Precisely. The data is so compelling. A 2021 study reviewed over 3,000 MRI scans of patients between 70 and 85 who had mild cognitive issues. 86% showed some kind of abnormality, but get this, only 3% of those findings were linked to an actual treatable condition, like a tumor or a major stroke.
So 97% of those patients went through the emotional and financial cost of being told something was wrong with their brain when there was no real problem imaging could fix.
And it gets worse, nearly 12% were sent for invasive follow-ups like spinal taps or even exploratory biopsies just because of the panic from seeing normal age-related spots on a scan.
I'm thinking of George, a 74-year-old retired engineer. He was worried about forgetting where he parked. His MRI showed those white matter changes, and he just convinced himself he was on a fast track to dementia. The anxiety got so bad he stopped driving, stopped going to church, he isolated himself.
His memory decline was really driven by anxiety. It only stabilized after a simple cognitive reassessment. A paper test showed his scores were totally normal. The focus then shifted to simple things: better sleep, proper hydration, brain games. The MRI gave zero medical benefit but created months of suffering.
The takeaway for you is clear. Unless there are severe, sudden symptom seizures, a really rapid decline, a sudden personality shift, an expensive MRI is rarely the right first step. A better, safer start is a simple, paper-based cognitive screening test. It's cheap, it's effective, and it avoids the panic of seeing normal changes on a scan. All right, our journey continues with test number 3, the cardiac stress test. This is super common for seniors who report, mild fatigue or just feeling a bit off. The goal is to spot blocked arteries.
The core issue here, especially after 70, is the incredibly high rate of false positives. Because older hearts just react differently to stress, studies show that in people over 70 with mild or no symptoms, the false positive rate, where the test incorrectly flags a major problem, can be as high as 40%.
40%. To think that 4 out of 10 patients are being scared into invasive procedures because of a false alarm, that's a massive system failure. So where does that false positive lead them?
It leads them straight down the path of unnecessary invasive procedures. Angiograms, stents, sometimes even bypass surgery. The doctor feels obligated to investigate that scary warning from the test.
And if we look at the data on what happens after those procedures, it gets even more concerning.
It does. A major 2017 study looked at the long-term results of stenting in these patients. It found that more than half of all the stents placed after a stress test referral were in patients who got absolutely no improvement in survival or quality of life.
So they took on all the risk of an invasive surgery for zero benefit.
Worse than that, they had higher rates of complications from the procedure itself. Things like internal bleeding and acute kidney injury from the contrast dyes they use, complications that often led to long hospital stays.
I mean, look at Raymond, a 75-year-old retired postman. He was active, but he mentioned he felt tired walking up the steepest hill on his route. His stress test was inconclusive, so they ordered a catheterization. They found a mild narrowing and put in a stent. He then developed kidney problems from the dye and spent nearly a week in the hospital.
And they later figured out his fatigue was just from poor hydration and not getting enough rest. The mild narrowing in his artery likely would have never caused a problem, but the procedure to fix it caused a very real one.
So if you aren't having those classic cardiac symptoms, chest pain during activity, severe shortness of breath, the sources suggest safer options. A simple resting EKG, or even better, a coronary calcium scan. It's a low radiation test that actually shows plaque buildup without that crazy high false positive rate. All right, test number 2 is the colonoscopy. This has been the undisputed gold standard for so long, so seeing it on this list, especially after age 70, represents a huge philosophical shift. Why has the risk changed so much as we age?
It's a few things. First, the prep is brutal. The laxatives can cause serious dehydration and kidney problems in older adults. Second, the sedation. It carries unique risks to brain function in seniors. And third, the procedure itself has a much higher risk of mechanical injury, bleeding, tearing, or heart rhythm issues than in younger people.
And at the same time, the amount of life you might gain from screening drops off sharply after 75.
Absolutely. The data reveals this really alarming risk-to-benefit ratio. A 2019 study followed 1.3 million Medicare patients over 70. They found that for every 1,000 colonoscopies done on patients over 75, only 2 lives were statistically saved.
2 out of 1,000. That's a tiny benefit.
But over those same 1,000 procedures, the study found that more than 20 people had serious complications that required hospitalization. We're looking at a 10-to-1 risk-to-benefit ratio. You are 10 times more likely to be seriously harmed by the procedure than to have your life saved by it.
That data is so strong, it's actually changed the official recommendations.
It has. The U.S. Preventive Services Task Force, the gold standard for this stuff, now officially recommends stopping routine colon cancer screening for most people after age 75. The risk just outweighs the reward.
Think about Dana, a 73-year-old grandmother. No family history, no symptoms, but she was urged to get another screening. They removed a small, benign polyp, but that same night, she developed a life-threatening bowel perforation. It required emergency surgery and 9 days in the hospital to recover.
And the source notes she'd already had 2 clean colonoscopies before that. The benefit of a third was minimal, but the risk of the procedure was tragically real.
So if you're still concerned, what's the safest alternative for someone in good health who wants screening without all that risk?
For most older adults, a stool-based test, like the FIT test, is the answer. It's highly effective at detecting blood, it's non-invasive, no prep, no sedation. It's a massive reduction in risk for pretty much the same outcome in detecting potential cancer.
And that brings us to the most high-tech, aggressively marketed, and dangerous screening test for asymptomatic adults. Number 1, annual full-body CT scans. These are sold in those expensive executive health packages that promise to catch cancer early. Let's talk about the profound, unexpected cost here.
This test is the ultimate proof of our thesis today. High tech is not the same as high safety or high benefit, especially for seniors. There is zero clinical evidence that these general, untargeted scans save lives in people without symptoms.
And the harm here is twofold. You've got the immediate radiation and then the inevitable cascade it creates.
Exactly. Your body is exposed to an extremely high dose of ionizing radiation. This is the energy that can actually alter DNA. Each one of these scans delivers between 10 to 20 millisieverts of radiation. That's the equivalent of about 500 chest x-rays in one go.
That is just staggering. Let's repeat that statistic we teased at the top, the one that links this screening directly to causing disease.
A 2023 modeling study is clear on this. It suggests the rise in these unnecessary CT scans may be statistically responsible for up to 5% of all new cancers in the United States. To put that in perspective, that puts the harm of this kind of screening on par with the known cancer risk of daily heavy drinking.
1 out of every 20 cancers, potentially caused by a scan someone bought to prevent disease. That's not just irony, it's a massive, perverse outcome of technology outpacing wisdom.
And if the radiation doesn't cause cancer, the cascade might ruin your life anyway. These scans always find what doctors call incidentalomas, harmless, age-related things like tiny liver cysts, minuscule lung nodules. The panic that's triggered when you see that on a report then kicks off more invasive tests.
Which means more procedures, more panic, more risk, all for a finding that's completely benign.
Just look at Marcus, an active 80-year-old martial arts instructor. Felt great. He paid for a private scan, and it found a tiny 3-millimeter nodule in his lung. That led to a P scan, another high dose of radiation, then an invasive needle biopsy. The nodule was benign, of course, but the biopsy collapsed part of his lung. He was hospitalized and spent 2 months in painful recovery. All for nothing.
The consensus from every major professional group, including the American College of Radiology, is stark. These full-body CT scans should never be used for general screening in people without symptoms. Targeted imaging is only for when there are specific symptoms, like unexplained weight loss. Scanning a whole body with no clinical focus is, as one doctor in our sources put it, like searching for treasure with a landmine detector.
So what does this all mean for you, for the listener? I think the core lesson from all 5 of these tests is that for seniors, modern medicine is powerful, but it's imperfect. And often, less is genuinely more. The focus has to shift away from fear-driven screening to truly targeted, symptom-driven tests.
Right. Your time, your peace of mind, your health, it's all too valuable to risk on procedures with proven high false positive rates and the potential for severe harm. The key takeaway is simple. We have to bring critical thinking into the exam room. When your doctor suggests a routine test, you should always ask two crucial questions. First, how will this test result actually change my treatment plan?
And second, and this is maybe the most important one, what happens next if the test finds something? If the answer involves invasive procedures or high-risk drugs, or if the data shows, as we have today, that the risks are clearly higher than the reward for your age group, it might be time to just pause and ask for a safer, non-invasive alternative.
Given the data we shared today, that lifestyle changes are 20% more effective than some drugs, and that one type of screening is linked to the same cancer rate as daily drinking, we have to ask, should we fundamentally redefine preventative care? If behavioral health, staying active, eating well, sleeping deeply is demonstrably more effective than expensive high-risk testing, should we even call that technology-driven testing preventative care at all? That's the question worth mulling over before your next annual checkup.